Hi everyone, Dr. Nemechek here, and I want to go over why constipation can affect behavior negatively. So constipation, there's some confusion about really what causes constipation. People think of it as just the opposite of diarrhea, where diarrhea, you have too much moisture in the stool. Constipation, you have too little moisture in the stool, and that's not exactly it. Diarrhea is from irritation of the small or large intestine, causing fluid to be released, so you get too much fluid in diarrhea. Constipation is an impairment of the nervous system, okay? And it could either be locally, that you have some bacteria that might release methane that'll kind of cause paralysis of the gut in a way, but most commonly it is due to here what you see, the autonomic nervous system. I talk about this a lot in the book, and all the kids with autism have big problems here. All right, and so when you have a big problem here, or when you have a problem here, what happens is your intestinal tract, so here we've got stomach, small intestine, large intestine, it slows down. So it's like a conveyor belt. It'll slow down. And so you can get an autonomic injury like an adult can, say from a simple concussion. So you slip and hit your head in the bathtub, okay? And you get a concussion. One thing that will happen is this will slow down, and about 50 to 70% of adults will be constipated in the first week. Okay, so that's a nervous system problem. The other thing that happens when you have an injury here is, so if this tip of this orange pin is your head, you have trouble pushing blood into your brain at the right pressure. Okay, and these kids with autism have horrible problems here. Really bad problems. I mean, this in an 18-year-old with ADD is low pressure in the brain. Kids with autism, much worse. Okay? And that low blood pressure is what causes your hyperactivity, your anxiety, your agitation, your aggression, your lack of focus. All of that is from one problem, low pressure in the brain. Now, how does constipation make behavior worse? So constipation is the slow motility, and we know that when the bowel is like constricting, or the person is bearing down to try to expel the stool, that can drop your pulse rate, and that'll drop pressure in your brain. Okay, this happens a lot in the elderly, so they may be on blood pressure medicine or something. They're a little constipated, they're on the commode, they're bearing down, boom, they pass out. All right? What happens with these kids is they're horrible constipation, they're backed up, they're having, when it's bad, the colon's clamping down, they're having the same effect, the pulse is dropping, the blood pressure's worse, the behavior's worse. Remember, low blood pressure, anxiety, agitation, hyperactivity, aggression, self-injury, all that can spike. But it's from the constipation. Okay? And it's from the bearing down. And it's because you have brain injury giving you constipation and a brain injury giving you low blood pressure of the brain. Now, both of these can recover on the protocol, but one thing you may have to do is give them something for the constipation. And I recommend, if you're going to give them something, just give it every day. Give them something every day. If they don't need that much, just give them a small amount every day. Instead of waiting and like, oh, it's getting bad, let's treat them again. So maybe every 3 days or every week you give them something. If you're better a little something every day, you're better with just the stool flowing. I don't want them to have diarrhea. I don't want them to have accidents. But even if the stool's a little soft, or maybe you can get them and they're just going regular once a day or even once or twice a day, you'll be better off, and you'll have less of these kind of negative outbursts from the constipation. Okay? So that's all for today, everybody. Have a great day. Take care now. Bye.